Alright, so I did my presentation on chronic obstructive pulmonary disease. So, chronic obstructive pulmonary disease, or COPD, is an inflammatory lung disease that makes it more difficult to breathe. So, if someone has COPD, they also have a higher chance of getting other illnesses such as heart disease and lung cancer. And they don't really know why exactly um, getting COPD will increase your chances of getting heart disease, but studies show that it does do that. And so two like other conditions that are linked to COPD are emphysema and bronchitis, and they usually occur together and they end up leading to COPD. And it's also a progressive disease, which means that it gets worse over time. But if you don't smoke and um, uh, treat it regularly, then you should be able to live like a normal life. And so yeah, the best way to prevent it is just to not smoke. And if you like work in a factory with a lot of chemicals and fumes, it's another way to potentially get the disease. So if you wear like a mask working at one of those jobs, it would be better and decrease the chance that you're gonna get COPD. So some of the symptoms for having this lung condition are that you have a lack of energy, um, shortness of breath, and tight chest, and you'll have a chronic cough because your lungs are always trying to like get rid of the mucus that are like pretty much overflowing within your lungs. And like you're also more at risk, and when you get like any normal respiratory, like if you get the flu or something, you're at higher risk if you have COPD, and then you'll wheeze because it's harder for you to breathe. So the way it affects your lungs is that, um, well, since your body needs the bronchioles and air sacs to push the air out of your body, uh, COPD causes them to overexpand so it doesn't work properly, and then the air from your lungs, there'll be still be some trapped in it after it pushed the air out of your lungs. So emphysema causes the walls and the elastic fibers of the alveoli to be destroyed, and bronchitis causes your uh, bronchial tubes to become inflamed, narrowed, and make your lungs produce more mucus. So, like the main part is environmental, like just not smoking will drastically decrease your odds of not getting it, but there is also a genetic component because one out of every 100 people with COPD have an alpha 1 antitrypsin deficiency, which is just a protein that helps protect your lungs. Um, so people without it are going to be at a higher risk for it. So that's why I'm sure some people have the genetic disorder but don't get COPD, but there's 1% of the people who have COPD that do have this genetic disorder, and it's on chromosome 14, and this is just the gene that controls it. Okay, so for the death rates, uh, men are at a higher death rate, um, are more likely to die from COPD, and that's only because, or mainly because, men are more likely to smoke in the United States and in most parts of the world, so they're gonna have higher death rates for it. But it's really the death rates aren't really too high, and these are my sources.